Hey everyone, welcome to Flare Fact Fridays with Stasha. That's me. I'm so excited to get this series started. Today is the very first episode of this, so bear with me. I've got some technical difficulties, but we'll see if it works out this time. And I'm so excited to get started with you guys. So each week, what I'm going to do is I'm going to unpack a lupus flare that many of us deal with. And so some of these will be very obvious to other people, like rashes or seeing those experiencing joint pain or fatigue. And then others might be something more internal that maybe not everybody can see, but we can definitely feel. So, with each of those flares, I'm going to unpack what it is, how it shows up, what might trigger or worsen it, and then what you can do to manage, limit, or even possibly prevent it at sometimes. So, you'll get my favorite tips and tricks, maybe things to make the tough days not so tough, and just keep you informed and kind of in the loop. I'd love to bring some awareness to some of these flares that maybe some people don't even know are associated with lupus. So, that being said, if there is a flare that you would like me to unpack, leave a comment or send me a message on Facebook, and I would love to get that going on my next one. So, let's go ahead and get started. So this one is going to be about mouth sores. There is some photos. So I will let you know before that slide comes up. If that's something that you don't want to see, I'll just tell you to close your eyes, but leave your ears open, and I will let you know when that slide disappears off the screen. So mouth sores can actually be a sign that your body is about to have another flare as well. So it can be a very good warning sign that maybe something else is about to come. And lupus can cause inflammation. That's the big thing with lupus, is it causes inflammation potentially everywhere. And so with that, also your mucous membranes are affected. And so when I say mucous membranes, I'm talking about the like skin inside your nose, around your lips, inside your mouth, roof of your mouth, and your gums. And so that's where the autoimmune comes in, because it's your body's immune response to itself, where it's attacking itself. So the immune response of your body is picking the wrong target. So that's where the autoimmune comes in. So up to half of people that have lupus actually experience a mouth or a nose flare at some point during that. They can be painless or slightly sore, but there's also the extreme of that where it's extremely painful and makes it really hard to eat. So here's the pictures. Sorry. So the first one on your left, you'll see it looks like a little blister on the lip there. That can sometimes be mistaken as like you bit your lip and you've got a little skin that's raised, kind of causing a little blister. Or some people have mistaken them for cold sores or canker sores. So the one underneath that, showing on the roof of the mouth there, it almost looks like a burn. But definitely is a lupus sore. You can see that it's kind of reddened around the outside. It's very, very irritated. And then as we move to the cluster of 4 pictures here, we can see that they can get progressively worse. The picture D there is extremely inflamed, irritated. You can tell it just looks like it hurts really bad. So, and again, with the lips potentially looking like a cold sore, you can see where maybe red along the lip line there that it maybe started to present as a cold sore, but you can tell that it's completely different. It does not have the weepy, ness that a cold sore tends to have, where it kind of like puffs up to that specific point. Very red and very inflamed, very, very irritating. So, pictures are all gone, guys. So, possible triggers of this would be your basic autoimmune response. So, anybody who has an autoimmune condition, lupus especially, it's that overactivity of your immune system, which unfortunately targets the mucous membranes in your mouth. And so that's when you'll visually see those sores. Other things to consider are environmental triggers. So infection, stress, even exposure to UV light. So a lot of people with lupus avoid the sun at all costs because it does give some rash across the skin. And we can talk about that later. But even specifically speaking to the mouth sores, any UV light can actually create an exacerbation of that. So there's also the genetic factors that play a role in all of this as well. Everyone has their own DNA. Some of us are predisposed to other things more than others. So while this, 5 people may have lupus, maybe one of these people is more prone to mouth sores than the other. Just unfortunately, the way our DNA can be made up. And another trigger could be hormonal changes. This you see more in women than you do in men. Lupus is more prevalent in women than it is men. So with this, I'm speaking to pregnancy, menopause, getting close to like your cycle. You might notice a significant increase, or maybe if you've never had them before, a mouth sore. And unfortunately, there are some medications that we take to help manage lupus, some of which are called non-steroidal anti-inflammatories, or NSAIDs. Tylenol is probably the first one you think of when I say that, as well as some immunosuppressants. So that can also have oral ulceration, unfortunately, as a side effect. And then poor oral hygiene. While this is not a direct relation to the mouth ulcers, it is good to practice good oral hygiene for several reasons, but this one specifically is eliminating the chance of those sores turning into infections. So some prevention tips that I'd like to share with you: using a soft bristled toothbrush, getting a good quality toothpaste that does not contain sodium lauryl sulfate in it, um, avoiding direct contact with soda cans, which I thought was really interesting. I didn't know that. So use a straw instead of drinking directly from the can, making sure to visit your dentist regularly, avoiding chewing gums, limiting hot or fizzy drinks, and then cutting down on smoking or vaping is just good for overall health. But especially with this, we don't want to dry out, leave a bunch of things in the mouth, and potentially cause some infection to go through the system. You also want to avoid certain foods that have been shown to contribute to the development of mouth sores, which a couple of these I knew, but some of these I had never heard of before. So I knew about tomatoes and strawberries and coffee just for the acidic properties, but almonds, chocolates, cheese, and wheat flour was really interesting to me. Although I have heard that wheat based products, even like snacks, so goldfish, can actually contribute to cavities because it leaves that residue sitting on your teeth. And so I thought that was really interesting. I'd be curious to know if anybody is gluten free, if they seem to have less mouth sores than others, or if that just happens to be luck of the draw if you end up getting these mouth sores. So I've kind of compiled a list of mouthwashes that you can get over the counter. Things you want to look for is making sure it's either alcohol free or it has limited amounts of alcohol in it. So some of those explicitly say alcohol free, which is super nice. But if not, just check the ingredients label, especially if it's one of your favorites, and just see if that can maybe be a contributing factor of you having those mouth sores. We want to treat those as quick as we can. So mouthwashes containing alcohol can actually reduce your saliva production, which leads to a drier mouth and can cause numerous other issues, but especially aggravating those oral sores. Alcohol-free mouthwashes still contain your fluoride and things that are good for your teeth. So you're not missing out on that. You're just missing that alcohol component, which can be extremely irritating. There is also a prescription mouthwash. It's called Magic Mouth. And this is often prescribed to those receiving chemotherapy treatment for cancer. One of the side effects of chemo and radiation is mouth sores. And so a lot of oncology patients will experience that. So this is extremely popular and something you would want to talk to your provider about. So this is my list of kind of what I've looked at as far as pretty common mouthwashes that you can find in your everyday, Walmart, Safeway, Walgreens, things like that. So I'm a big Listerine fan. I've always liked Listerine, and they make a couple that are alcohol free. I personally like the mint because the mint to me makes me feel like my mouth's cleaner. I know that sounds so silly, but that will always be my choice. Another thing is Crest also makes a really good one as well. That is also mint flavored. And then Act. I always have liked Act, especially I have two little girls, and the Act mouth rinse has really good fluoride in it, and it's alcohol free as well all the time. And so it's really good about protecting those teeth and your enamel. The TheraBreath Fresh Oral Rinse is specifically marketed for bad breath and dryness, but because of the non-alcoholic property, it does soothe the mouth and it does not burn. So it helps with the bad breath as well, but it also helps without having the alcohol in it. Biotine, same thing, marketed for dry mouth, helps to increase your saliva production to limit the dry mouth. Crest 3D White, I wish I could like this one. For me personally, I have really sensitive teeth, and so I don't want to put anything on my teeth that's going to make them more sensitive than they already are. And so if there's some sort of bleaching property within this mouthwash, I want to avoid it at all costs. Kind of side note here, when I had a permanent crown being placed, I was having a little bit of a flare up, and the dental tools that were being used while I was numb, I could feel every little scrape from those dental tools, and I could not figure out what was going on. And if you've ever had a crown placed, when they scrape off that temporary cement, if you can feel it, it is awful. So I did some digging and I found out that the metal that is used in the dental tools to create those dental tools is actually an irritant to those with lupus when you're in a flare. So it's got some nickel in it. And so I'm wondering if that kind of goes back to the soda can, avoiding the can itself and just drinking through the straw. I'd be curious to know if those two are correlated somewhere. So maybe I'll do some digging on that and get back to you guys. These last two mouthwashes I'm not super familiar with. They seemed really popular when I looked them up. I recognize all the other ones, but those two are ones that seem to be a little more on the expensive side, as far as I can see, but less ingredients in them, so maybe a little more natural. So again, a little more expensive. Now, chapsticks. I have a chapstick in every room in my house, my purse, diaper bag, work bag, car, everywhere. I love my chapstick. And even though they can say alcohol free, there might be other ingredients in there that makes it more sensitive. So for me, while mouthwash I really like, mint, I avoid that with my chapsticks. I feel like it makes my lips more dry, more irritated. I feel like I'm like kind of chewing on them more. Like I get those like little patches of dry skin around it. I just don't like it. So I personally like to get something that's more like shea butter based, kind of leaving like a film on your lips. That seems to help. And then at night, you want something that's going to be more of like an ointment style type thing, like kind of thinking of like Vaseline, something super thick, going to seal in the moisture for you. And good rule of thumb, keep your chapstick in a cool, dry place. Heat, yes, it melts it, it makes it sticky. Excuse me. And but if it melts, it can also degrade the active ingredients in the chapstick, making them less effective. So there's a list of some chapsticks. Again, some of these are pretty common, kind of price range wise. I like the Vaseline or the Aquaphor. The Aquaphor is a really good one. They market it for kids like diaper cream as well. But Aquaphor is really good for your skin just overall. It really seals in that moisture. So the fact that they make a lip balm is awesome. Burt's Bees seems to be a really popular one. I don't like it for whatever reason. I don't know if it's the beeswax or the texture of it. I just don't feel like my lips stay as soft. I feel like I'm reapplying that one more than I seem to do any of the other ones. EOS is my favorite, the EOS chapstick. I don't like the ball, I like the stick. But again, I avoid their mint. Even though I love their chapstick, that one particularly, I feel like dries my lips out more than anything else. So that's it, guys. That's all I have for you for this. I hope you've enjoyed this. I would love to continue to do more of these, and I would love your feedback on this. And tell me what you think. Tell me what you want to see. If there's any questions, feel free to reach out, and I look forward to talking to you guys soon. Thank you so much for tuning in.